To me, please. Make this easy on yourself. You don't want to reach over here to do this.
You want me to move them towards you though, right?
Yes. No, you just move over. They're capable.
She's not pregnant.
I'm not good. Get them to move so that you're comfortable. Okay, we don't need to do that. So this is how you get your hand. You got to get your hand underneath them. You're going to go between their legs and cup the sacrum in your hand. Okay. And this is how you do it. You bend their leg, knee up, and you go under here. Okay, and then we're just going to roll you over onto your side. Okay, and you slide your hand under the sacrum. Okay, and then you straighten the leg. And then I say, my hand's a little bit too far on this side, so I'm just gonna lift you a little bit and squish my hand over, lift your pelvis a little bit, wiggle back and forth until I can feel the sacrum right in my hand. Okay, now, my forearm is on the table. My elbow is that far away from her pubic bone. Okay? I have plenty of room here. There is no concern with inadvertent contact of genitals because you will not be anywhere near. You will not be anywhere near. Okay? Now, my second hand. Okay, I have to give you some direction first before I get my hand lost in there. Do this before you get them. Okay. So take your hands and just put them on your hip bones right there. Good. And when I tell you, I'm going to get you to push in and hold. So I'm going to give her the direction of how much push I want you to do. So I want you to push in with this much push on both hands. Can you do that? Good. And you're going to hold that for about 5 seconds and I'll tell you to stop. Okay? Good. So make sure that she knows how to do that before you get your other hand lost in under her body. Okay. So now I've got to take this hand and I've got to get it underneath and onto the lumbar area. So when you slide it underneath, I suggest you already have the fist made because it's really hard to go in like this and then try and curl your fingers under the body. So have them already curled like that. Just put your hand right there, please. Push your hand down into the softness of the table and get underneath them. And then you got to wiggle your lumbar hand down so you can feel the fingers of your sacrum hand. You want to be fairly close. Got it? Okay. Now here's the other thing. Her belly's right there.
It's soft.
I'm very close to her. Okay?
You take a rest. Right?
So you just have to be.
There if you wanted to.
No, you just have to be. You're not going to do this at board exams.
Okay.
You will not do this at board exams.
Okay.
This is postgraduate.
How do you know I won't?
I know exactly.
Go crazy.
If you decide to, then you be very clear. And you say, my chest is on your leg right now.
Okay.
I can't help that. I'm not even big chested, and my chest is touching her leg.
Pillow
Okay?
protection.
And all you just say is, that's my chest on your leg. Okay?
I hope
Okay.
you like it.
Make sure, just keep your head turned to the side. Okay? Especially when you're dealing with a male body. Because that's different right there. Okay, I'm pointing out the maybe not so obvious to you right now, just so you're aware of it, right? So you just keep your head turned to the side. To the side, whatever you want to do.
Don't breathe too deep.
Now, here's the tricky part. So now, I have to sink into her body, which means lifting. And I'm going to do that by doing a bicep. Just engage my biceps and lift. Up until I feel
Which one?
both. My lumbar hand and my sacrum hand.
Basically, you want to bring her a little closer.
So I'm lifting. I'm lifting up.
Yeah.
And now I'm going to stabilize with my lumbar and I'm going to draw her sacrum inferiorly.
Is this like cranial sacral lifting, or is this
No,
like
this
real
is lift.
deal? Okay.
This is lift.
Okay. Not just the intention of
No,
lifting. All right.
lift. Okay, now I want you to put your hands on your hip bones there. And now can you squeeze in for me and hold right there? And that just goes click, and then just let go. Great. So it didn't take very much for that little gap to happen in her sacrum, and it just allowed her sacrum just went whoosh, it moved down a little bit. I'm going to hold it for a little while. Who's videotaping this? Come around to my other side, and just so you can see what my body's doing. I'm doing all the things you're told not to do. I'm touching her body with my body. I am bracing the table with my right leg to hold there because I'm pulling with some force. Okay. I'm trying to keep my back as straight as I can.
So this is.
I feel fine.
Close your eyes, Haley.
Okay.
Where are you?
Okay.
That's like a...
And now to come out, you just slide that hand out. You just lift the pelvis a little bit and slide your hands out.
And you take it either.
Okay.
Not on the
Can
first
you show us
treatment?
again what you're doing underneath? Just.
Yes. It's a little.
Sacrum.
So I have taken my first hand and I went under her, between her legs and underneath, and I sweeped it underneath while I rolled her pelvis over and swept my hand so that it just went over her hip and find the sacrum. So you want to have the sacrum resting in your palm so that the coccyx is sitting about there and the top of the sacrum is right about there. And it will just rest nice in your hand like that. Okay? In this hand, I bend my fingers, I slide it under the body and get so that the SPs are sitting in the groove where my fingertips are. And then I shimmy my hands down so they've got my fingers touching. So they're fairly close. You don't want to be too far away. It makes it, you're more effective when you have your forces closer together.
Yes.
Okay? And then using my biceps, I will lift up so I sink through the soft tissue until I feel like I've got bones really firmly in my hands. And I hold with my lumbar hand and I decompress with my sacral hand. And once I feel like I've got that engagement, because it won't go so far, then I ask my patient to do a little push with her hands in on the pelvis, and it'll push these in and will loosen up that SI joint, and you should feel the sacrum just slide down a little bit more. And then they sort of get to hold that for about 5 seconds, and then you tell them to relax. You keep holding, and you just keep holding, and it might just creep down a little bit more, and you might feel kind of a softening around the sacrum.
Question.
Yes.
What if people, like in my case, my sacrum is shearing downwards? Right? Like